I think one of my concerns is I know so many people out there that view these medications as a silver bullet, and they're getting by on eating just small amounts of processed food, not moving their bodies. They're seeing the numbers on the scale come down, so they're happy, but they're not actually a silver bullet, are they?
No, I think it is true that they really help control appetite, thinking about food, and most people taking the medication will absolutely reduce their intake of food and hopefully be in calorie deficit and lose weight. That is true, but like any other medication, if you stop it, the effects of the medication will wear off. So for a real effective weight loss, it needs to be the right kind of medication for you, specific to you, your needs and your goals.
These medications help quieten the food noise, they make you feel full more quickly, more easily, and they reduce the drive to eat. But as soon as you stop the medication, the food noise comes back, the drive to eat comes back, the capacity to eat a large amount of food comes back. So what do people need to do alongside the medication in order to have a chance of maintaining weight loss longer term?
I think there's a lot that we're learning, and I think there's still a lot to learn about the best way for people to stay with their lower weight once they've stopped weight loss medication. But you're right, just like any diet, if you don't stick to the changes, your weight will come back. So important things to think about. The biggest difference is what changes you make to your lifestyle, the things that are going to make the biggest difference. And the idea is making the changes whilst losing the weight is what will help keep the weight loss off.
But on this topic of weight regain after the medication is stopped, so the reality for a lot of people is they do regain the weight, don't they?
The jury is still out because we know behaviour change takes months, if not years, to set in. Potentially in the UK, where people are self-funding, they may be on it for a shorter period of time, not long enough to make those behaviour changes. So I honestly think it's probably going to be years before we really know what the weight gain story is. But I think we can all be fairly consistent. If you don't change anything in your lifestyle and just stop a medication, the medication stops working. This is just common sense, but data's a mixed bag.